lipid lowering agents, dyslipidemia eliminating drugs or managing drugs. The commonest of these drugs is the statins. They inhibits the HMG enzyme. It lowers the cholesterol, very low density lipoprotein, and increases the expression of the lower density LDL receptors. So thereby more endocytosis, that is taking the lipids into the cell and lowering its serum level. The dose is 5 to 80 milligram depending upon patient severity. Usually 5 to 20 milligram once in a day is good enough in majority of cases. The side effects of the statins is the myalgia. That's why the muscle pain severe you do and see your CPK, creatine phosphokinase. At times it can cause the drug-induced hepatitis. In those cases you can do the ALT and stop the drug for time being, and then when it is over, that the ALT has come down to normal or CPK is normalized, you go for reintroduction. Rarely it enhances diabetes mellitus, predisposes something. Again the same mechanism. It's not permanent sort of things. You can give later on. Second most largest group is the your fibric acid derivative, gemfibrils, fibrozil, clofibrosil, and so forth. These drugs they reduces the VLDL expression and reduces the LDL, increases the LDL expression. So the patient having triglyceride, higher amount of triglyceride, he use the clofibrate and this group of drugs. Dose is 600 mg BD adult dose. It has GI upset, hepatitis, and cholelithiasis, myositis. They are sort of complications. Third group is the maybe the fish oils. Small fish, preferably 1 to 1.5 kilo, 3 to 10 gram daily. Can be used in VLDL low receptor. VLDL, the more VLDL, that is reduces the VLDL level. Third group may be the ezetimibe, that is your cholesterol absorption inhibiting drugs. Ezetimibe, it increases the hepatic LDL receptor expression. Thereby it causes the dyslipidemia control, and it is used in refractory your statin dyslipidemia. So the side effects are same, myositis and so forth. And your fourth one maybe your evolocumab, which improves the LDL receptor expression, thereby more endocytosis and reduction of your LDL from the serum. So it is also used in statin refractory cases. And then you have bile acid sequestrants like cholestyramine and cholestyramine and used in the LDL more LDL hyperlipidemia. And lastly you have nicotinic acid, again used in LDL improved LDL raised LDL situation. So these are the ways that you go on giving it this hyperlipidemia reducing agents. They control dyslipidemia, but when the drug is stopped for time being, this level dyslipidemia again develops. So thereby you use interrupted way. At times you can use lifelong, as it is needed, because the toxicities, as I said, they are not that very high and not the permanent sort of damage. So cost and the risk is not that important. Important is that controlling dyslipidemia for lifelong dyslipidemia control is very important.